Jessica. I'll be your nurse today. Today we're going to be doing a neurological assessment, and we're going to start off with just a mental status test and check. So first I'm going to ask you a couple questions. So can I get your name and date of birth?
Jody Rich, 6/18/71.
Good job. And then next, why are you here today?
For neurological assessment.
And then where are you?
In my home?
Perfect. Last question is, what month is it?
November.
Awesome. So she is associated to why she's here today, who she is, where she is, and what month it is. Perfect. So we're going to move on to a motor movement test. Just going to kind of test some of her coordination and her muscle strength mainly. All right, so first I'm going to have you extend your arms out to me like this. All right, and then hold that for 10 seconds. Perfect. She's held it for 10 seconds. Now you're going to squeeze my fingers to test your strength. Perfect. All right, strength is intact. All right, now you can lower your arms. Now I'm going to have you lift your left leg up, or right leg, whichever one works. Hold that for 10 seconds. Good job. And then next one for me. That's held it for 10 seconds. Perfect. I'm going to have you extend both your legs, okay? And then I have you push against my hands, and now lift your toes to your nose, so up there. Perfect. That is intact as well. All right, so we've just completed the motor movement test, and now we're going to be moving on to the cranial nerve assessment. So for the first cranial nerve, we're going to just test her olfaction. So I'm going to have you smell this for me. Tell me what that smells like.
Peppermint.
Good job. Next, we're going to be moving on to the second cranial nerve. It's going to test her vision. So she's already passed the Snelling chart. She has 20/20 vision. So I'm going to have you put this in front of your left eye. All right, I'm going to stand over here. I'll get out of the way. So what I'm going to do is when you see my fingers, say yes. So
Yes. Yes. Yes.
okay, now switch cards on the other eye.
Yes. Yes. Yes.
Good job. All right, now that is done, I'm going to put these cards over here. Now we're going to be assessing cranial nerves 3, 4, and 6. We're going to start with cranial nerve 3. That's going to test her visual accommodation and then her pupil symmetry and perla. So we're going to start and see if her pupils dilate or constrict when they see light. Perfect. And then we're going to see if they accommodate. So perfect, they accommodated. Okay, and so we can see that her pupils are equal in symmetry and they're reactive to light, and they accommodate. Perfect. Next, we're going to move on to our cranial nerves 4 and 6, which is going to test her peripheral vision. So keep your head straight and only move with your eyes, okay? So good job. You did good. Next, we're going to do cranial nerve number 5. Cranial nerve number 5, it's just going to test like your chewing and gritting of teeth ability. So pretend to chew for me and like grit your teeth. Good job. Swallow. Good job. Next, we're going to move to cranial nerve number 7, our facial nerve. I'm going to have you lift your eyebrows and then squint for me and then puff your cheeks. All right, perfect. You passed that. Next, we're doing cranial nerve number 8. It's just going to test her hearing. So in a perfect world, if I had I could do the Weber test where I hit the instrument and then she'd hear the vibration, but due to lack of supplies, we're just going to be doing the whisper test. All right, so I'm going to whisper something in your ear and then repeat after me.
Hi, Mom.
Yes, good job, you got it. Next, we're going to move to the cranial nerve test for 9 and 10. They kind of go together, so I'm just going to have you open your mouth and say ah.
Ah.
All right, good job. Next, we're going to be doing cranial nerve 11, and that's just going to test your elevation and depression. So lift your shoulders against me and then lower your shoulders. Okay, good job. And now lastly, we're doing cranial nerve number 12, and I'm going to have you stick out your tongue. Yep, it's midline, and now move left to right. All right, perfect. That cranial nerve number 12 is intact. So she's just demonstrated all the cranial nerve tests for all 12, and she's passed them successfully. Next, we're going to move on to the cerebellar test. That's going to kind of test more of her proprioception, her movement, and her balance. So we're going to start with the balance test. I'm going to have you stand up and put your arms and feet together like this, and then just stand there. She's stand there for 20 seconds. All right, perfect. Now you can be done.
Sit
You
down.
can keep standing up.
Okay.
So I'm going to have you do the tandem walk. You're going to walk heel to toe, and I'm going to evaluate your gait. All right, perfect. Then you can go back and sit down. Alright, now that you have done that, we're going to do a quick coordination test. You're going to take your thumb and then you're going to go like this and touch all your finger pads with your own thumb. Yeah, you can do that. Now you're going to touch your finger to your nose before hitting my thumb. So like that. Alright, now do it again. Now do it one more time. Good job. You did great. Good job. And then lastly, or second to last, we're going to move on to our sensory function test. We are going to start with our light versus dull touch. So I'm going to have you close your eyes, and then you're going to tell me what feels sharp and what feels dull.
Sharp?
Yes.
Dull? Sharp. Dull.
Yes. All right. Good job. Next, you can keep your eyes closed. We're going to test her light touch versus no touch. All right. So when you feel this, let me know.
Yep.
All right. Good job. So that's intact. Now close your eyes. Now hold out your hand, and then you're going to tell me what this is.
Ball.
Yes. Next, I'm going to write a letter in your hand. Close your eyes, and you have to tell me what letter it is.
A.
Yes. And now we are going to do the 2-point discrimination test. So you can close your eyes for this. I'm going to use the erasers. And when it starts, it's going to be 2 points. And then when it starts to feel like 1 point, like let me know when you feel that. So this.
1.
Yes, good job. All right, lastly, we're going to do her tendon reflex test. We're going to start with her bicep one. So I'm going to have you flex your arm like this. I'm going to find your tendon. Perfect. And then I'm going to have you just keep your arm just out like this. Just relax your arm and open up your hand. And then I'm going to hit it with my, supposable hammer. There we go. Good job. Now flip your arm for me. Thank you. And then I found it right here. We're testing her tricep reflex. I'm sticking it right above her tricep, and I'll do the same thing, and her hands will react. Perfect.
That's a good one.
Yeah. Next, we're going to move on to her patellar reflex or her quadricep reflex, whatever you have. So next is going to be, we're going to find that tendon area right below her kneecap, and then we're going to do the same thing, and her knee will kick. Good job. That's good. There we go. Lastly, we're going to be doing the last one, which is the Achilles tendon reflex. And so, in a perfect world, if she was higher up, her legs would be dangling. But what I'm going to be doing is I'm holding fingers right here. The hammer would hit right behind, above the ankle, right on the Achilles tendon, and her foot would just kind of move. Her toes would move a little bit. Yeah. All right, perfect. So now we have gone through all the tests, which include the mental test, the cranial nerve test, the motor movement test, the cerebellar test, the sensory, and then we did our reflex test. So thank you for participating in today's neurological exam.